very much, Dr. Raffia, for your comments and support. Now it is my pleasure to introduce one of our workshop planning committee members, Dr. Lemmy McNeely. Dr. McNeely is the Chief Staff Officer for Speech Language Pathology at the American Speech Language Hearing Association and holds a doctoral degree in speech language pathology, among many other achievements. You can find a bio sketch for Dr. McNeely and all of our speakers in your addenda packet. She is going to introduce our opening speakers, so I turn it over to you now, Lemmy. Thank you.
So I'm really pleased that we're having the opportunity to communicate with each other. And it's my pleasure to introduce Dr. Keith Mays, who is the Dean and an Associate Professor at the University of Minnesota School of Dentistry. Dr. Mays has had advocacy to enhance oral health as a pathway to improving overall health, and that has certainly shaped his research interests in oral health and in interprofessional education and collaborative practice specifically, which is certainly near and dear to our hearts here. And I welcome you to our session today. And Dr. Mays, please move forward with your information.
Good afternoon, everyone, and good afternoon. Thank you, Dr. McNeely, for that great response. And thank you to the National Academies and to CareQuest for inviting me this afternoon to share a few words just to kick off the workshop and to bring some perspectives around oral health. Next slide, please. Just a standard, I have no financial conflicts or interests to disclose. I am a DIA board member and I speak for myself, not for DIA. So just want to make sure that that's divided. Next slide, please. So I want to start out with images of what I see in healthcare. I'm a fairly visual person and advance the click 4 times, please. I really kind of appreciate images. They speak to me a lot. And so when I look at some of these images, one of the things that I see is an absence of oral health. And I think that as we have these conversations, it's important for us in oral health to advocate that our presence as a part of the healthcare team be really presented to others in just that fashion, and that we're not seen as absent or to the side or a secondary factor, but that oral health is just as important as overall health, and that oral health contributes to overall health. And so I always like to start, these types of conversations with kind of how I see normal everyday people kind of viewing healthcare. Next slide, please. So one of the things when we think about access to care is our health professional shortage areas. And so this is a slide that you probably, or numbers that you all probably seen, really looking at the relative numbers of shortages in primary care, dental care, and mental health. It shows that we certainly still have some work to do. Just click once, please. You can see that we have some pretty significant numbers across these 3 focal areas. In preparing to talk today, I kind of used the same slide in a talk last spring, and it was interesting, but the health professional shortage areas increased. And that really means we have a lot of work to do in that space to kind of reduce our access to care problems in these 3 areas. Next slide, please. Many of you have probably heard the story about Diamante Driver, a kid from Maryland, who died because of lack of dental care. It wasn't that dental care wasn't physically there, but it was because of the overall issues within the health systems related to insurance, also related to social determinants of health and how his mother had to access care, and challenges with finding a Medicaid provider. And so this is a big space in which we need to do some work. We should not have our children dying because of lack of being able to get to a dentist. We have the means to prevent this. And I think that as a team, we should all team together as healthcare providers to really eliminate these type of tragic outcomes. And it highlights the importance of oral health when you're thinking about overall health. Next slide, please. Now that was 2007, advancing forward to 2017, 2020. It shows that we still have a relatively high rate of untreated caries in US adults. This is just a briefing from the ADA News, but just highlighting again that there's a substantial amount of unmet healthcare need in our US adult population. And that, you know, for me, trying to say that this challenge of really caring for people's mouths and oral health is still a challenge. And what is connection for me between this and Diamante Driver is that it can have tragic outcomes and death, but it can also have outcomes in lost days of work. It can also have people not really wanting to smile, not really wanting to socialize, not really want to engage the socializing people. And so it can have all manner of ramifications when we have this level of untreated disease. Next slide, please. Marco Vucek is an economist who works for the American Dental Association, who does some outstanding work in general. And he did a write-up in 2014. And for me, it creates a picture of that there's a really huge opportunity here. And so when he looked at medical offices, it was determined that there was 108 million people who had not gone to the dentist in a year's period of time. And on the other side, when we're looking at dental offices, there were 27 million people who had not gone to the physician. And so for me, this is an opportunity and highlights the importance of really looking at medical dental integration, because if we were in a practice model in which these individuals were co-located, then it's much easier for us not to have this gap, because individuals could be right down the hall, down the floor, but in some level of proximity in which we can capture both dental and medical care in the same kind of time frame, and that we wouldn't have this large gap in healthcare right here. And so I think this is a great opportunity that we have, and when we're talking about transforming the health system. Next slide, please. There has been some great work done. This highlights some things. This is a blog that was written up by Rick Valakovic. But I still think that reimbursement is one of the big issues here, especially as it relates to Medicaid. There's been some great work across the country where here showing 14 states have improved their rates. I know that in Minnesota, we have improved our rates, and that's very, very helpful to improving this problem. Medicaid has become a part of the Affordable Care Act. The CHIP program has been a great success in treating children. There's several states in the District of Columbia that have good benefits as it relates to adults. And more recently, CMS is now re-looking at their fee rates as it relates to dental exams and equalizing that payment when we're working with our medical colleagues in organ transplants. And so this is a great space in which I think a lot of work needs to be done, is in reimbursement. And this is I think a challenge for dental providers to participate, and has been a challenge in the Medicaid program. And I think that whatever the resolutions are ultimately is something that we have to face as one of the elephants in the middle of the room that is challenges when we look at access to care and improving our nation's health. Next slide. And so the last slide that I want to show this afternoon, again, as a tee up for you all, to think about is one of the challenges that I face as a dental educator is helping my students to understand that it's not just about the tooth. And so that it's about the patient's overall health, but it's also about the patient's life. And so we know that social determinants of health play a big role in our patients' care and their overall health. And so we just did a pilot study. This is a very preliminary study, very preliminary data just from this summer, in which we just scanned the unmet social needs within our dental clinic over a few months within the summer. And so we had a response of 175 individuals. And it just kind of highlights in that population, there were two big things that kind of stood out. There are several other things that are there as well, but employment was really big, and obviously finance connected to employment is going to be big in this preliminary data. But we do see some challenges with food and housing as well. And so what I think is important here is what we're trying to lean in and begin to do is to find out what these needs are so that we can develop a screening model in which we can begin to get our dental students to screen for social determinants of health so that they are, as I stated, not just looking at the mouth, but looking at the whole patient. And so I think when we think about this thing from both sides of the aisles or all sides of the aisle, that we need to all be kind of helping each other and helping each other to help our patients. And that's for me, the bottom line outcome is better patient outcome and better patient care. And so those are the thoughts that I just wanted to layer on you. I know this is a robust area. You all are going to have some great conversations with in your breakout rooms and discussions. But I just wanted to kind of give you a slight view of one dean in oral health and how I view some of these things and where I think some of these things are so important. Next slide. And I thank you for giving me a few minutes to just to share my thoughts.
Great. Thank you, Dr. Mays. Thank you for sharing some information with us that's frightening in some ways, but some areas did show some improvement with respect to Medicaid funding being available and included in most states, right? Medicaid is a state-based program. Can you also elaborate on the role of interprofessional education in preparing the health workforce so that we are able to truly work collaboratively? And as you provide us with that response, I just want to remind everyone that please, we're interested in your questions. So please type the question in the Q&A. And if our co-chairs have any other questions, please make sure that you share those with us. Keith?
Yes, so interprofessional education and collaborative practice are extremely important. And it's critical for us to, as you kind of heard me allude to, begin to, not just for me, not just to think of myself as a tooth doctor, but to think of myself as a oral health provider and a health provider. And therefore, I should be concerned about my patients' mouth, but also how that may relate to cardiovascular disease or diabetes, or whether or not my patient needed to take 3 buses to get here today. And so some way in the educational process, which is full with content and curriculum and time, we do have to squeeze in these other things. And so I think that we need to work with each other across the aisle to kind of do those things. We had a great opportunity during COVID in which we trained physicians, nurses, pharmacists, and dentists to do COVID vaccinations. And that was a great example of a great response and an interprofessional collaborative education experience. And it culminated in my students being able to do some flu injections the following year. And so becoming a part of the whole health team. And so I think this is critically important. We also have our hygienists who go on rounds with the physicians, and that's training them to be there, but it's also training them, our medical colleagues, residents, to look at the patient's mouth, be concerned about the patient's mouth, have me come look at the patient's mouth, and that there are other things that may be going on. And so this is a critically important space. I think the other piece, and sorry for being so long-winded, is that the reimbursement issue and the cost for care is huge. And so one of the ways to kind of help that is helping each other and reducing some of these financial burdens across all by teaming up with each other. And so I do think that one of the ways that we're going to get to the place of value-based care and reducing cost of care is by intercollaborative practice. So those are kind of my thoughts.
Great, thank you. Isabel or Naomi, do you have questions that you'd like to pose?
I don't have necessarily a question for Dr. Mays, but I'm in awe of what you have been able to accomplish. I think all of us can really learn lessons from the many things that you have instituted. And I think this is really the perfect opportunity for us to learn from one another, and really to, perhaps start with baby steps towards that integration. So I know that, it sounds like a huge, almost intractable problem, but it really isn't, right? If we take, some of the steps as you have described.
Yeah, I totally agree with you. I really applaud my hygienists for that step. Excuse me. They've been doing that project for a few years, and just recently got a Delta Dental grant to just expand it. And when they were sharing me some of the data from it, I was just astounded of the number of individuals that they had impacted, the number of residents had been a part of it, medical residents had been a part of it. And to your point, it started with a small step, small idea, and it's grown, and now it's growing, and a lot of other units in the hospital are interested. So I think to your point, it's really kind of just reaching out, building that first thing, building the second thing, and building a third thing.
Absolutely.
Great, thank you. I know we have a focus on the babies who don't yet have teeth, also needing to have their oral health assessed. And so I know that's definitely something that speech language pathologists are engaged in as we work with young children who have feeding and swallowing needs and or some concerns relative to their abilities to acquire language. So a number of disciplines have been working in silos with this birth to 5 population. And I do think it's really ripe for opportunities to continue to educate students in an interprofessional manner across the fields of speech language pathology, dentistry, medicine, nursing, social work, and the list kind of goes on and on. Thank you. Other questions?
While people may be thinking of a question, you're absolutely right. We had a program in one of our community clinics that ended from a funding standpoint, but it was very good. We had one of our hygienists who worked with one of our dentists, and they went into the OBGYN clinic when people were giving birth and before they were giving birth, and set up a relationship, and the patient filled out a card, which a year later activated an examination of the child, and so that ran for several years, and it's an early intervention and great prenatal care, and so to your point, I think there's some rich opportunities around that space.
Great, thank you. If there are no additional questions at this time, we can move forward to